I'm Dr Michael Paterson, clinical psychologist and EMDR Europe Accredited Senior Trainer. I run trainings and workshops for experienced mental health professionals. In this video, one of them is asking me a particular question. Please join us.
I've come across a group called Attachment Informed EMDR. And I also think that some of my clients have trauma that goes back a very long way, perhaps even to very early childhood. And I wondered if you knew anything about Attachment Informed EMDR and what your feelings are about it.
Well, certainly it's a particular group that would be interested in using EMDR to benefit people who have an attachment wound. So we don't necessarily have to use the steps that they take, but the standard protocol works well. So say, for example, if we're thinking about the AIP model, what it holds is that particular experiences occur which can be stored maladaptively, and this colors our client's perception of how they see themselves in the present. So it affects their perception, then their attitude, and then their behavior. So if we could trace it back to an attachment wound, then we think, okay, what do we as the therapist need to do, first of all, to stabilize this client and create some internal integrity and stability for them? And whatever exercises that we can do, whether it be the like of ego state therapy or schema focused work in that preparation phase, or compassion focused work, then anything like that is going to create that stability, and it's about healing the wound. So I would regularly use experiences of asking the client to connect to the child that's maybe been neglected, look into the child's eyes. From that look in the child's eyes, what do you feel it is that that child needs? So it allows the client then to be introspective. Now, if you were to ask them, well, you as the adult, what do you think a child that had been neglected would need? Well, and then they speak from the cortex. Whereas if they look into the child's eyes, it gets past that and into here. And it allows the client then to be introspective and say, here's what that child part of me actually needs. So one of the things that I would mention at EMDR trainings is that we don't set aside what we already know when we come into EMDR therapy. We bring it with us. And we all know about Maslow's hierarchy of needs. And Maslow's hierarchy, it's about very basic functions of survival. The reptilian brain functions, first of all, sleep, food, be able to go to the toilet, water, things like that. Then the safety needs come after that, and then the emotional needs after that. So I'd be keeping this in mind by asking the client to look into the child's eyes. So they have this image of this little boy or little girl there, could be maybe 4 or 5 years old or younger, and look into that child's eyes. What do you feel that child needs? And then it allows them to say, so often it will be reassurance that you're safe, and well, could you, the adult, provide that for the child? Yeah, I could. So that's a good first step. We check that out. And so that way, well, if you would say to that little boy or that little girl, the words that you know the child needs to hear, and just let me know when you're done. So if I'm doing that as preparation phase work, then I'll be doing slow, short sets. And how's that? How's the child reacting to that? He likes it. Okay, and is there anything else you need to say? Oh, yes, there are a few other things. Okay, just let me know when you've done what you said, what you need to say. Again, the slow, short sets. That's it now. Okay, and as you see that little boy sitting there now, if you again look into his eyes, is there anything else that you feel he needs? I don't know. Do you think he could do with a hug? Yes, he could. And could you, the adult, do that? I don't know. So if the adult says, yes, I could, I would go with that step. But sometimes, as you well know, David, then there is a phobia of that child. And so that adult themselves can't do it. So what I would do in those circumstances would be, and say, well, if you can't do it yourself, who do you know who could give the child a hug? And it might be Mrs. Smith, who lived 2 doors down from the child whenever he was growing up or she was growing up. So Mrs. Smith then is a relational resource. So just as we can use relational resources to install to develop resources for our clients, resource development and installation, we can bring them in these circumstances too. So we could bring in Mrs. Smith. So there's Mrs. Smith sitting down beside the little boy or little girl, putting an arm around them, giving them a hug. And how's that little boy or that little girl reacting to Mrs. Smith hugging her? Oh, she likes it. She's smiling. Okay, and how would you feel about joining in and putting your arm around the little girl as well? Oh, I don't know. Well, what about moving a bit closer and maybe just holding the little girl's hand? Okay. Or if they're hesitant about that, what about just gently stroking the child's hand once while Mrs. Smith is hugging? Okay. So how did the child react to that? She liked it. Okay, what about stroking twice this time? So I'd do it as successive approximations. So just as I was saying earlier, we don't set aside what we already know whenever we come into EMDR therapy. So successive approximations, I learned about that initially as an undergraduate. So bring that in. So try it bit by bit. So if there's a phobia, it's an exposure-based type approach to take it step by step by step to try and heal that wound. Interestingly too, Robin Shapiro, who wrote a book called EMDR, or a chapter, yes, I think she was the author of the book EMDR Solutions too. There's a chapter in where she talks about working with adult survivors of neglect. And what she had done with the particular client was invite them to imagine you're the baby lying there. And then looking up, and mom's there with you. Can you describe what you see? She's looking through me, or she's looking past me, or she's turning around and walking away. Now, whenever I read about this, first of all, I thought, no, that's not going to work. And then I thought, well, hang on, Michael. Robin Shapiro isn't going to write that in the book if she hasn't tried it out. Give it a go. So an opportunity arose within a week, and I did try it and got tremendous results with that. So that way that she was able to connect to the child's emotion, which she wasn't. If you were able to ask her, what was it like for you as a baby being neglected? I don't know. But by using this projective type technique, then the client was able to link to that, feel the emotion that was in there, and then what do you think that baby might need? And then go through those similar steps. So we can do it for the toddler, we can do it for the older child, we can do it actually for the baby as well, but that's a way to get around that. Anything that we can pick up from the attachment-focused EMDR to use in the preparation phase or the desensitization phase is going to be of benefit. So there's lots of positive things there too that we can pick up on. And so it's about reading different things, different perspectives, and picking the best of it and using it. And that's, I suppose, what I learned in the very early days of EMDR. There was people who were using ego state therapy in the preparation phase. So I thought, well, this is interesting. I learned a lot more about it and read up on it and attended seminars. And initially it was done by hypnosis. But then some enterprising therapists said, well, let's try the bilateral stimulation. So I tried that too, and then appeared to be getting even better results or faster results using the bilateral stimulation while doing the ego state work. So that's the way I would do it now. So it cuts out the induction and deepening phase that you would use in hypnosis.